Professor Peter Lee and his team are leading the CMIT ARC Centre for Medical Implant Technologies, which is leading a close collaboration between researchers at the University of Melbourne and industries in the Medtech sector. The centre is an outstanding example of how university research and research capability can directly benefit industry and also lead to improved benefits for the community through better patient outcomes. The 10 PhD candidates within CMIT are working in their own dedicated workspace where they receive guidance from university supervisors, clinicians and industry engineers. This means that they are gaining significant industry-ready skills in ethics, research translation, medical device development and medical device regulation. The CMIT team is led by Professor Peter Lee, but also includes Associate Professor David Ackland, Dr. Jia-Yee and Ms. Meg Belmonte.
The Australian Research Council Training Centre for Medical Implant Technologies is funded by the ARC. It's a centre that focuses on training PhD students, early career researchers to work closely and interact with the industry. We connect them with industry partners representing the entire global supply chain, and we have a total of 23 partners in the centre. This network provides us with all the necessary components to develop a real-world training environment. Our industry partners are all committed to helping us develop PhD projects right from the start and continues to help us supervise and mentor students throughout their research.
Our students will have the opportunity of working in the medtech industry supporting medical device development. This might include SMEs and startups through to large multinational companies such as in orthopedics. Our PhD students work closely with our partners and have a compulsory placement, so they're ideally positioned to gain employment with them after graduation.
I'm working with my industry partner Maxonic, and we're studying the functionality of the temporomandibular joint prosthetic with the hopes that having a better understanding of how it's working from a mechanical perspective will allow us to elevate the outcomes that we get for patients.
We work with our industry partners to address unmet needs and come up with projects to solve problems in medtech. We are pleasantly surprised that we have attracted PhD students from around the world.
We developed an online module on personalised medical device development in partnership with Epworth Healthcare. Key elements of the module itself includes case studies, one of which is Australia's first 3D printed titanium jaw joint implant that was developed as part of a PhD project led by Professor David Ackland. We're really excited that this training module has been offered to Praxis Australia. It's been licensed so that they can offer this module to those from the pharmaceutical sector, to those from the medical technology sector, the research and academic sector, as well as to entrepreneurs and those from the startup community.
My name's George Dimitroulis and I'm the founder and clinical director of Maxonic. Basically, it's a medical device manufacturer and design company that deals with cutting-edge products. We leverage the resources of the University of Melbourne, particularly the students and the postgrads, so that when we come up with ideas, we have the know-how and the ability to bring something of an idea into a commercial reality. Working within the university I think is so important because in isolation there's very little that we can do, but in the company of a big university like the University of Melbourne, particularly the engineering school, I think we can make a lot of things happen. Maxonic has benefited from the close proximity to the University of Melbourne, and as a surgeon who's still operating on a daily basis, I find it very enthralling, very exciting to be part of this team of researchers who are developing the cutting-edge products that we use today. It's one thing to do research in isolation, but another thing to do it in conjunction with someone who's at the coalface. The relationship with the university is an important one because the university provides the resources to make sure that whatever device we use is going to be successful, it's going to be safe, and it's going to be a better outcome for the patient.